All right. Well, again, thank you for joining us for the Enhancing Psychosocial Support for Cancer Survivors Project webinar today. I'm happy to welcome the team from Southeast Iowa Regional Medical Center Palliative Care Program. They'll be sharing lessons learned from their Cancer Survivorship Grant Project. And we will have time at the end for questions and answers. So I will let you guys take it away.
Thanks, Megan. Um, we have a group of four that was part of the planning and implementation process of that. And so our group of four includes Daria Reinschmidt, who's a radiation therapist, um, Megan Winke, who is a licensed independent social worker, Carrie Wellington, who is a social worker on our palliative care team as well, and I am Amber, I'm a nurse case manager. So before we get started, we want to thank the Iowa Department of Health and Human Services and the Iowa Cancer Consortium, where we receive funding. They receive funding from the Centers of Disease Control and Prevention to make all of this possible. And then we also want to thank the Iowa Cancer Affiliation Network, ICAN, because without them, we couldn't have done any of this. So thanks for all of that. We wanted to start today's presentation with one of our patients that we're gonna, for this presentation, call her Peggy. Peggy was one of our patients, and this isn't exactly a picture of her, but you can picture her as the person there in the middle with the white hair. Peggy was a 64-year-old female who came in with lymphoma. When I first met Peggy, she was in terrible pain, had great emotional distress, and really was like, I don't know what to do next. Has several young adult kids who also then have young children, and she was really just the glue to that family, and everything was turning upside down for Peggy. Um, Peggy then went through about 2 years of treatment, and she had a great response to treatment. We had the privilege to see her CT scan and the doctor's note prior to Peggy knowing this information. We saw that the CT scan said there was no evidence of recurrent disease, and the oncologist said follow up in 6 months. So when Peggy came in to see us in palliative care, we thought we were celebrating good news with Peggy. And the minute she walked in, we could tell that something was wrong. She was visibly upset. She was tearful. She said, I don't know what I'm doing next. Her cancer treatment was her purpose. Her cancer care center people were her support team. She had lost all contact with her primary care provider because of cancer treatment. She had quit her job because she couldn't do treatment and do her job, and she was really just lost. Megan, our brilliant social worker, then said to her, Peggy, when you look in the mirror, what do you see? And this is what Peggy said back. I was a strong, independent woman, and now I'm just ugly. And so when we thought as a team, the news was great response to treatment, follow up in 6 months. This is good news. It was really hard news for Peggy. And so we knew as a team, we need to do something different. We need to do something in addition to. And so really our why for this Survivorship 101 class, we really kept Peggy in the back of our mind when we were planning this and implementing it. So as we got started, the really where you have to start is defining what a survivor is. And so the definition by national standard is a person is considered a cancer survivor from the time of diagnosis through the balance of life. There are many types of survivors, including those living with cancer and those cancer-free. And that definition comes from the American Cancer Society. But as you can tell, that is a broad definition. And in fact, as we were meeting with some of the stakeholders to get our class offered, we even had some conversation with the oncologist of what is a survivor? Let's define that. Let's narrow this down. And so for this project, we really did have to define what is the target population for this project. So what we used was those who have finished treatment of cancer. And then the participants of this program are usually familiar with the side effects going through treatment, but they're not familiar with the long-term effects of treatment. And we got that definition from A Time to Heal, which we're going to talk about later. And that was our target population, those who had finished treatment. And then also their caregivers. So we opened up this group to a caregiver, which we're going to talk about later as well. So picking a curriculum, how do we even get started? The Iowa Cancer Consortium presented us a wonderful opportunity to receive a 2-day training for 4 people. So we were the 4 people that were selected to facilitate a Time to Heal program. We sat down, we looked at the Time to Heal information. We were pleased to see that it was one, evidence-based, and two, holistic, which were really our two measuring sticks that we needed for this project. So that was exciting to us once we figured out that this was going to meet our needs. And we really found benefit in the program. You can see there that Kay Ryan is the author of this, and she actually was one of the people that came down to teach us along with one of her colleagues. So we feel like we got firsthand education on how to teach this curriculum. And then they have been great to work with post after that. If we have any questions, we just reach out to them. So if anybody has any questions specifically on a Time to Heal, we can kind of talk about that too. So Survivorship 101 class is actually just a piece of a really bigger thing called the Survivorship Committee. And Megan is in charge of that. And so I'm going to let her talk a little bit about that.
Perfect. So our hospital system as a whole is working towards accreditation through the Commission on Cancer. So with that, I think you guys are probably aware there's many steps and there's many process improvements that are recommended and need to be put into place. So one step of that is forming a survivorship committee. That's supposed to be a multidisciplinary team that gets together and thinks of the different ways and areas that they can improve care and treatment for survivors finishing treatment. So our multidisciplinary team includes myself as a social worker, the director of our cancer center, a PCP, the manager of athletic training, a radiation therapist, a physical therapist, a speech therapist, a dietitian, and an RN. So we really tried to look at the patient from all angles. So within the program, you're supposed to find at least 3 things that you can implement and measure and track. So our first initiative that we started working on was this 9-week A Time to Heal program, and it really just spurred on what the direction that we went moving from there. We were able to do a needs assessment. Some of the other things that we worked on, we created a flyer to show therapy available for patients who are finishing treatment, a flyer giving information on dietitian follow-ups after treatment, reestablishing care with PCPs following treatment, survivorship care plans, comprehensive needs assessment, streamlining the mental health referrals. Um, and then we're also working on 3-month follow-up phone calls for patients after treatment to check back in and see if maybe they're at a different place in 3 months than they were the day they finished up with their doctor. So this curriculum fit in perfectly into that process that we're trying to build into the hospital-wide initiative.
Great. Thanks, Megan. So all of this though takes funding. The way we funded our the Survivorship 101 class was that a grant was presented by the Iowa Health and Human Services and the Iowa Cancer Consortium. And then we were thrilled to receive that grant. We applied for that grant with the help of the Iowa Cancer Affiliate Network, and they set us up with a grant writer. We'll be honest, without that grant writer, that would have been very difficult for a nurse and a social worker and then the radiation therapist. That is just not something that we had in our toolbox. And so we were just very thankful for the support of ICANN through that process. And then we were pleased to find out that we had received funding. So this is what our budget looked like when applying for the grant, and then also this is how we expensed our items. So you can see the first item, and really the biggest item, is staffing. We had decided to provide this class outside of hours, outside of office hours, so in the evening time, and this is what the budget it would take for staff pay. Then we used a Time to Heal and their materials. And then, so that had that budget. And then marketing was a budget. And this is one place that we're going to talk later on about lessons learned, but marketing budget is really needed because the biggest barrier is getting people to come. And so every dollar that's spent on marketing that gets a new person there, we feel like is a dollar well spent. The next thing was a Time to Heal had encouraged us to hold a graduation after that 9-week period was up to celebrate our participants. So we just had some small graduation gifts there. The next line item is transportation. What we did is we gave each participant a $10 gas card for every session they showed up to. And every single one of our participants said that that was needed and appreciated. And they then showed up the next week. And so we do think that those gas cards really did help with that.
Would you say, especially since we're in a rural area
Yes.
where public transportation isn't available from community to community?
Yeah, that's good. Thanks for adding that. We had people coming from about an hour away. Some people were coming as far as an hour away. And so just helping with that, that cost, they said was helpful. Then the last thing was the owl camera, and you guys are seeing the benefits of this owl camera. We wanted to make sure, again, being in this rural area, that we provided availability to anybody who wanted to join. So we offered a virtual option, and we really did need this owl camera to do that. Now that you can see how you can see the whole room, and then whoever starts talking, the owl camera automatically goes to that person. So we really do feel confident that we could have somebody join us virtually and really be able to participate in the class. Now, while we offered that both sessions, nobody did end up coming virtually, but we're pleased that we'll be able to continue to offer that with the equipment that has been purchased. So the marketing efforts, like I said, is really, it was key because we need to get people here, and we couldn't have done it without Daria and her efforts, and really what I think the value she brought of being that invitation by a trusted person was invaluable to our team. And so can you talk about that?
Yeah, so I went through our treatment schedule and our patients that had finished within the last 3 months with their radiation treatments and personally called any of the patients that I thought would benefit from this class and that they would get something out of it. And every participant that we had that said, I came because you called me and you meant something to me and you asked, so here I am. So that personal touch, I think, made the biggest difference as opposed to just seeing a flyer or talking to somebody on the street or a radio ad. It made the biggest impact in our participants in the class.
Can you talk a little bit about the Relay for Life event too that you went to?
Yeah, we reached out to our local American Cancer Society here, and they had a Relay for Life event at a community event. So we set up a booth and talked to the survivors that were coming to that and told them about our class. And we were able to pick up a few people from that as well, some of which had been out of treatment for several years. This isn't limited to people who finished in the last 3 months. They could be finished 10 years ago and still benefit from this class because it covers such a wide variety of topics.
That's a good point. How about the flyers that we created and the rack cards and other things that we did?
We've presented the flyers. We have 2 different flyers. We have one that's just an all-encompassing that doesn't have specific dates that are in our rack cards throughout the hospital. And then we also created flyers that had the times and the dates that we were offering the class, and we put those out throughout the hospital as well, handed those to patients when they were in active treatment or when they were coming in for their follow-ups so that they knew it was upcoming to try to communicate with them, but still trying to catch that population that isn't actively in our cancer center at that specific time by putting out the general placards throughout the hospital that may be following up with their PCP or in the hospital for some other appointment.
Yeah. I like how you said that somebody could be 3 years out. And so they're not touching our health system necessarily, but they could still be struggling to find their new norm. And so I love how we were able to go to that Relay for Life event and actually did get 2 participants from that event itself. Okay. So what our class structure entailed is that we did offer two classes. When we budgeted, we decided to offer two classes with the goal of 10 people in each class. Now, with this is why we know that marketing is so important. We had 4 people come to the first class and 3 people come to the next class. However, we think if we helped one person, it was worth all of that effort. And I know that we helped more than one person, as we're going to share in the survey results. But the class structure, we really wanted to, the environment was set up in a way to foster communication, an opening, welcoming environment that would spur on discussion. The format then was really, we were following a Time to Heals format. And so it was pretty consistent each week where we would go over the information provided. There were breaks. There was a gentle exercise that we would lead. A power tool was presented each week and practiced, and then also some guest speakers. But what I think the secret sauce of the class structure really was is that time that they got to talk to each other. Whether it was a time at break or the time after, or really just during the class, where one person could talk about the other thing and go, "Oh, I'm not alone. I realize that there's somebody else that's struggling with that same thing, and it seems silly to me, but I guess it's not silly because other people are doing that as well." So that is kind of how we structured our classes. One way that what we found really benefit is including guest speakers. And so Carrie is going to talk about our guest speakers.
Yes, so we learned through feedback from our participants that these guest speakers that we had were very beneficial. We used the resources that we have within our health system. We picked speakers that fit within the curriculum. For example, we had a week focused on fitness, and so we had our physical therapists come in to speak. They shared their insight and then also available resources that we have within our health system. Other than the physical therapists, we also had our spiritual care chaplains, a lymphedema specialist, a mental health provider, and along with our own cancer care dietitian.
So in order for us to know, did we do what we said we were going to do? Did we have value? We used a Time to Heal survey that they actually used too, but we gave it to every participant. And Carrie, do you want to talk about what we found out?
Yeah, so we gave a kind of a pre-test, one at the very beginning, and then this is the evaluation at the end that we used with all of our participants. It was tailored to kind of the feedback that we wanted to receive from our participants. We use this information to see kind of what they learned, but then also to use going forward to kind of tweak things to just kind of improve over time of our classes. Through these surveys, we found there was 6 common themes that participants found either useful or kind of comments that they had. Those themes were knowledgeable presenters, understanding of their new normal, support from the group, insight into others, focus on living and joy, and then a tip of increasing publicity to kind of have more members in our groups. And then also on that, we kind of had the comments and also just kind of overall data that we gathered. We asked participants how if they met their expectations and then along with how they would rate our presenters. But the kind of the main takeaway that I found with this is we asked kind of their knowledge before and then also after. So you can see here, most people were around the 2 range for their knowledge before the program. And then everybody was in that 4 or 5 range after the program, just kind of showing the value that this class offered and that everything that we taught and the things that they learned really made an impact on our participants.
Through these classes, there were definitely some memorable moments. Something that participants said that said like, "Oh, that's good," or "Oh, there's healing that's taking place." And one of the stories that Megan shared to me, I just thought was beautiful and got to the heart of why we were doing that. So I'm going to let Megan tell that story.
We had one patient earlier. Daria mentioned that these people might be multiple years out of treatment, and the participant that I'm talking about had been out of treatment for 2 years and was kind of still working on figuring out who am I now and what does this look like, and still working on processing through it. And whenever she would start to tell her story, she had had breast cancer, and she would kind of grab here and she would say, this thing that happened to me. And she never referred to it as cancer. It was always this thing that happened to me. And one day we kind of asked her about that and said, do you realize that that's how you're addressing it? And she was taken aback. She didn't realize that this whole time she had kind of been using this protective language and not actually saying I had cancer. And with that, I think just that realization, like she was able to think about it. And I remember her saying, that must be the way I was coping with it. I guess that isn't very healthy. And once again, kind of coming back to coping doesn't always have to be healthy or unhealthy. Sometimes it's just the only way our mind and our body gets us through a situation. So kind of normalizing that for her and letting her just say, I was strong enough to get through this however I needed to. And now she's able to go back and talk about it and process it and deal with it in a way that maybe she couldn't before. But from then on, she referred to it as she had cancer. And it was almost a lightness, I feel like, that she was able to show, and a pride
Yes,
that
definitely.
she had just kind of was continuing to make these steps. It just meant a lot to me. There was obviously a lot of stories, but hers kind of just hit home for me. And it was that person that had been out of treatment for a while. And she also was the one that said at the end, I am so glad that this is going to be built into cancer survivors' journeys. I'm so glad that this is going to be built in to support people in the future. So I guess it just hits home for different people at different stages, and they have to be ready for it to really matter.
Thanks for sharing. So through this, we have learned a lot. Like I said, we offered 2 sessions, and even from session 1 to session 2, it was like, okay, how can we be better? And now even going forward, we have sessions already in place for 2026 and the rest of 2025. But there are definitely things that we learned along the way. One is target population is important. So it just happened to be that in our first group, one of the caregivers for somebody that was post-treatment, she was actually going through breast cancer treatment herself. And while that was she's welcome to attend, it did change the group dynamic. And so it really did kind of show us why they, if possible, can be post-treatment and why that's important. The second thing was that we found the curriculum to be very beneficial. Our plan is to continue to use a time to heal going forward, as we are pleased with that curriculum and their evidence-based practices that they have. Third, we found that the gas cards were vital in reducing that financial barrier. We did not want the being in a rural community and private transportation to be a barrier at all. And it seemed like that really reduced that simple $10 gas card, reduced that barrier altogether. We found that the guest speakers were of great benefit. Not only did they promote our health system about all the other wonderful things that are offered here that people had no idea, but I think people really saw them as the expert. And this is a place where I can ask the expert these questions so I can learn more and discover more. And then we can't say enough about our grant writing support through ICANN, because it was crucial. We wouldn't have been here without that support. So then future considerations, what we know is we really just want more people to come. We want to help more people. And so we know that we might need to increase our marketing for that. How can we think outside the box? How can we get more people? And what we're really hoping for is a lot more internal buy-in within the health system. If other people, that trusted person, can say, these are the benefits of this class, I think you would be this would be a next best step. I think back to Peggy. And if when the doctor said, I'll follow up in 6 months, if she said, I'm going to follow up in 6 months, but in the meantime, I'd like you to take this class. I'd like to prescribe this class for you to help you find your new norm, or I'd want you to consider this. So we're really hoping to make that program kind of part of the post-treatment plan, almost like a prescription that the oncologist is going to do. We want to continue those personal connections with the trusted staff. One thing that we are getting is a 1 month free gym membership. We have a beautiful gym on this facility. And so after completion of graduation, we want to offer them a 1 month membership. And then we are looking at changing the day and time, possibly maybe going to try a during the day class to see if more people would come. But really what the goal is getting more people here is our hope. And so what we want to end with is this is the picture of our graduating class of our first class. And this is something that they said to us as they left it. They left it on their survey. Sharing experiences with others made me feel like I wasn't alone. It opened my eyes and my life has changed and how my feelings are important. So thankful it is part of the treatment plan for survivors. And so we're just glad, like we said, if we could help one person, it was worth it. And we thank everybody for their support for this program. So now we would like to open it up to any questions anybody would have from any of us.
All right, thank you for the presentation. I think that if anyone does have questions, I think you can just unmute yourself and ask. We've got a small enough group today. Or if you don't want to ask out loud, you can pop it in the chat. So I do have a question. Have you worked this into your workflow then when someone does finish treatment, or have you figured out a way to have your providers then write this as a script yet, or are you still working on that?
We're still working on that. It's definitely something that we're working with leadership in that office and working with the oncologist. What I say at this time, it's cemented in, it's not. But I think that that's what we're working toward, and the survivorship committee is helping with that, really just spreading the word and getting to people to see the value.
Did you have any experience or any trouble with like your hospital administration buying into this program and supporting it? Did you have to get like official approval or just through your director?
We had the grant helps because it takes the financial piece out of it. And so that's why, obviously, there was some time spent in preparation for the grant. But then with the grant, since they're not so worried about the finances of it, there was a lot of support. And now I would say we did not apply for another grant yet. And so they are in support of doing it again because they saw the value that was presented when the grant was funded. So we've had like all yeses really from it, the leadership that we've talked to.
Awesome. Thank you.
Thank you. I was really even encouraged when we were a little disappointed with our numbers. You know, we were hoping to help 20 people, not 7. And the director of cancer care said, but if you helped one person, it's all worth it. And so I just appreciate that value of one person.
That kind of starts the whole movement too.
Yes,
So,
exactly.
yeah, it grows.
You build it, they'll come.
Exactly.
Just have to get started. Yeah.
Awesome. Thank you.
Thanks for your question.
Sure.
I think we've got time for maybe one more question before we wrap up. Okay, well, thank you again for being here and talking about your program. It sounds like a wonderful program that's had some great impact on folks that were participating. So thank you. You've got some nice comments in the chat there as well, so you can take a look at those. But again, thank you for sharing your project with us. And this recording will be available after the fact. So thank you.
Thanks for having us.
Thank you.